So just an overview of the cornea. The other is the lens, and then the vitreous body. Both these are again transparent, and aqueous humor is transparent, and vitreous humor is transparent. So the second important thing in cornea is it's avascular, and we know vessels are important for life, but the cornea takes its nutrition from the tear film, oxygen from the tear film, and it takes its nutrition from the aqueous humor. Outside of the cornea is this cornea has five layers like that. It has 5 layers. The most entry is the epithelium, and the most inner one with the aqueous humor is the endothelium. And from anterior to posterior, uh, first is epithelium, then this is the Bowman's membrane, then stroma, and then Descemet membrane, and the innermost is endothelium. So the epithelium and Bowman's membrane, these are derived from the ectoderm, but the stroma and endothelium and Descemet membrane. Descemet membrane is basically the basement membrane of the endothelium. Division of 6 by 60, and one thing is 6. So what is the difference between what is meant by this 60? 6 we all know that it's normal vision from 6 meter. 660, 6 by 60. Yes. 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 Exactly. So this 60 is the distance from where this letter can be seen by a normal person, but this diseased person is seeing this letter from the 6 meters, the uppermost of Snellen chart. So it is a histologic representation. So whenever there is opacity of the cornea, right, sometimes the opacity is active. For example, there is corneal ulcer. So this is medical treatment of corneal ulcer. We give topical antibiotics, we give subconjunctival antibiotics. Again, ideally we should have scraping, and we have heard that some pathology department is working here, and we would like to send scrapings of the cornea, whether it is bacterial or fungal. We use usually empirical therapy for corneal ulcers, you all know. So this corneal ulcer is treated. Once the corneal ulcer is healed, again it is healed by scarring. So what is the answer for this scarring? That is keratoplasty. So you take a donor cornea and you transplant to the recipient cornea. So for this procedure, the most important thing is to get the cornea. Once you have a cornea, then you can get a transplant of the same thing. So this is the indication for keratoplasty, that a central corneal opacity, whether it is dystrophy, whether it is due to trauma and some other corneal disease. So this keratoplasty is optical. Optical, it will give vision to the patient, provided the retina is okay, the lens is okay, the vitreous is okay. There are patients, they have retinal detachments, they have some other problems as well of or optic nerve, especially optic nerve problems, and they have corneal opacities and cosmetically ugly looking. They want keratoplasty for cosmesis, just so or tectonic purposes. Again, in the types of keratoplasty, one is the penetrating keratoplasty. The whole 5 layers are replaced by the donor tissue. So this is usually done in our country. penetrating keratoplasty. But in other countries, now they are transplanting these layers. As we discussed the 5 layers of cornea, now they are transplanting the only endothelium as well. There is anterior lamellar keratoplasty, endothelial keratoplasty. We did this penetrating keratoplasty last week in our hospital because we got some donor corneas with the good efforts of Dr. Javed Saif. So this is penetrating keratoplasty, anterior lamellar, just if the disease, we see if the disease is just in the anterior layers, we do not disturb the posterior layers of the cornea. And similarly, if the disease is in the posterior one, only the posterior lamella are transplanted. So again, some indications: full thickness scars, perforation of cornea, herpetic scars, vascularized scars, and one important thing is keratoconus. Usually in young patients, there is irregular stigmatism, and it is not cured by your spectacles and contact lenses. The last option left for this is, and we have many patients in our area as well of this keratoconus. So keratoconus is a and it is ectasia of the cornea, and is non-infiltrative ectasia of the cornea due to the weak basement membrane of the endothelium. Again, the procedure of penetrating keratoplasty, you have to take the donor, and we use the T-fine to take the donor from the button. People take people in other countries, they take the whole globe, and within 6 to 8 hours of the death of the patient, they take this cornea, and it is now then it is preserved in Makeover preservative, and it works for next 4 days, and in some other next 10 days, up to 10 days it works. So again, this is the pre-op evaluation. It is the work of the ophthalmologist to take the ocular history, visual acuity, intraocular pressure, and the tear film status. The tear film is very important thing. Again, tear film is, it is less than 1 millimeter, but again it has 3 layers. The anteriormost layer is lipid, the central one is aqueous, and with the cornea it is mucin. Due to the lipid layer, which is made by the meibomian glands of the eyelid, it restricts the tear film from evaporation. Once the lipid layer is disturbed, and a small disturbance of lipid layer, we all experience sometimes discomfort in. So the lipid layer is very important. Once there is a meibomian gland dysfunction, the lipid tear film is disturbed, so the corneal transparency is disturbed. Donor tissue preparation, how to refine it, post-op management, and post-operative complications. Again, lamellar keratoplasty and endothelial keratoplasty, its complications. So these are some pictures which we did last week with the help of Peshawar Medical College. Professor Mir Ali Shah, he is the Dean of Ophthalmology in CPSB. He visited our department with one of our class fellows from Khyber Medical College, Dr. Idris. So unfortunately, we could not get these pictures on this transparency, otherwise it would be a good thing to see. You can see the 16 stitches upon the cornea. Patient from Tangir, another patient from Harban, Drapuk. This is a patient from Drapuk. and from patient from Burmas. So we have some other pictures as well, but we could not upload it.